Hi there, my name is Dr. Martha Gulati, and I am happy to be speaking on behalf of the Journal of Cardiac Failure on the new 2022 Guidelines on the Management of Heart Failure. I would like to highlight some of the key findings and recommendations in the guidelines that focus on cardiovascular disease prevention. These patient-centric guidelines have a lot more than just the management of acute heart failure. There's an incredible focus on the prevention of heart failure. First, there are the 4 pillars of the management of acute heart failure. And this is an essential part of secondary prevention for heart failure with reduced ejection fraction. Additionally, the authors make it clear that words and labels, for that matter, really matter. We have a new category for heart failure in terms of our description. So somebody with heart failure with reduced ejection fraction, whose ejection fraction improves beyond 40%, we will now label that as improved left ventricular ejection fraction. Using those words is important both for the patient and also for the team. Lastly, the guidelines focus on how we can prevent heart failure. And they talk about 2 stages. There's stage A, which are the people at risk for heart failure, and stage B are the people with pre-heart failure, with some structural heart disease or other issues that put them at risk for progression of heart failure. Like hypertension, for example, to treat blood pressure as our guidelines currently recommend, that we want blood pressure control, knowing that it can affect the progression of heart failure with reduced ejection fraction, but also heart failure with preserved ejection fraction. And for patients with diabetes, we want to ensure that we start treating those patients, particularly the high-risk group. And SGLT2 inhibitors are kind of the star of the guidelines in terms of a new novel medication that we've been talking about for now many years, but now are embedded within the guidelines. And for all patients, for all people, in fact, preventing heart failure is key. And that means Life's Simple 7. That means working on healthy lifestyle in terms of diet, exercise, preventing people from starting smoking. So cardiovascular disease prevention is essential to both the management, but also to the prevention of heart failure. So be an early interventionist. Join us in terms of being a preventive cardiologist.